Good morning, everyone. Thank you for attending RetireSafe's second webinar where we're focusing on telehealth. Today's webinar is going to be hosted by RetireSafe's interns, Maria, Lila, Catherine, and Kevin.
Hello, everyone. So I'm going to quickly run you through RetireSafe's mission. RetireSafe is a nonprofit organization focused on educating and advocating for mature Americans in the public policy sphere on issues including Social Security, Medicare, health, safe retirement, and financial well-being. Now, below you can see all of your beautiful hosts this morning, and you can also see our wonderful president and CEO, Mark Gibbons, right here. So, we're going to get into some of the learning objectives that we plan to do in today's webinar. So, what we have is what is telehealth, how to navigate my chart, and how to sign up, pros and cons, in-person visits versus telehealth visits, current legislation, and at the end, we'll have a bit of a Q&A and a small little quiz. So first up, we have what is telehealth with Lila.
So, what is telehealth? Telehealth is the distribution of health-related services and information through electronic information and telecommunication technologies. In simpler terms, telehealth is using technology for healthcare. And I use a little picture at the bottom right so you can see an example of telehealth. So some examples of telehealth include remote monitoring of vital signs, blood pressure, health education services, and doctor-patient consultations over video call or phone call, which a lot of you guys have already experienced this past year because of the pandemic. So how do I set up a telehealth visit? You can call your provider's office and you can request a visit through MyChart or similar websites that allow you to view your health information. And Kevin will actually show you what MyChart is like, and he's going to show us a video on how to navigate it, a very brief video.
Right, so here we have what is my chart and how do you sign up. So we're just going to click on this link and we'll let you watch the video.
Medication refills, vaccinations, lab results, medical history, multiple treatment plans, and doctor's visits. At Premier Health, we know you've got a lot on your mind. Managing your healthcare is a huge responsibility, no matter who you are, and can often feel a bit overwhelming. That's why we're making your healthcare more manageable. Premier Health's MyChart puts your medical information at your fingertips, online and in one secure place, empowering you to take control of your healthcare by providing simple access to your medical records, online appointment requests, online payments, and one-click prescription refills. Have a question for your healthcare provider? Send them a message. It's quick and completely confidential. And for those days when you can't make it to the doctor's office, simply request an e-visit. Rest easy knowing that your medical records are kept up to date by your healthcare providers and stored securely on MyChart. Signing up for your free MyChart account is fast and easy. Simply visit the MyChart login page and click the Request MyChart sign up button. If the identification information you provide matches our records, you will be prompted to create a username and password to complete the activation process. In a few minutes, you will have complete access to your healthcare information from your smartphone, tablet, or computer, anytime, anyplace. To sign up for your MyChart account or to learn more, visit premiermychart.com today. Premier Health.
So yeah, as you can see there, it's really easy to sign up for my chart as long as you are getting permission from your doctors. Like they said, if you're in their system, you should be able to sign up no problem. And really, it just is a faster and more efficient way of getting care because everything you need is in one place from your prescriptions, messaging your doctor, making appointments, and test results. So I believe that the next thing is pros versus cons.
So some of the pros of telehealth is recording measurements like your weight, food intake, blood pressure, heart rate. sugar levels either manually or through a wearable device and sending them to your doctor. Also, having a virtual visit with your doctor or a nurse over your computer or smartphone, which is super easy and it's very practical because you don't have to go anywhere. Using an online portal, how we talked earlier about my chart or any other portal that you may be using to check your test results, request prescriptions, refills, send your doctor a message, or schedule an appointment. I want to say something about this real quick because I used my chart not that long ago and it was so good because I have to do a lot of blood work because my doctor asked to, and I got the results at 3 a.m. or something like that, and it was really cool because my doctor could have checked the next day, and she kind of replied back to me through my chart. So I think that was pretty cool. Sharing information such as test results, diagnosis, medication, and drug allergies with all your providers that you see. Coordinated care between your primary care provider and any specialist that you visit. Including the sharing of exam notes, test results between medical offices in different locations. Getting email or text reminders when you're due for a mammogram, colonoscopy, and other screenings or routine vaccination. I have my chart app on my phone, and I get the email also all the time reminding me if I have an appointment, if I have to get my medication, and all of that, which is really nice because we tend to forget everything. And finally, monitoring older adults at home to make sure that they're eating, sleeping, and taking their medication on their schedule. Now we're going to go to the cons. And telehealth offers a convenient and cost-effective way to see your doctor without having to leave home, but it does have a few downsides. It is possible to do every type, it is impossible, sorry, to do every type of visit remotely. You still have to visit the doctor, and you still have to go into the office for things like imaging tests and blood work, as well as diagnosis that require a more hands-on approach. The security of personal health data transmitted electronically is still a concern, but we have to remember that we have HIPAA and they're very good with all the personal information, and it's something that we shouldn't be worried about. But it's still, people are concerned about it. And finally, while insurance companies are increasingly covering the cost of telehealth visits during COVID-19, during the pandemic, some services may not be fully covered, leading to out-of-pocket costs.
So I'm now going to go over when a telehealth appointment versus an in-person appointment is more effective, depending on what's going on with your life. So telehealth is certainly more effective if patients are having trouble traveling to and from their local doctor's office. It can be used as a really useful replacement. Providers can also use remote patient monitoring to check up on patients who suffer from a chronic condition or those who are recovering from surgery. It's also very useful in refilling prescriptions because patients may not need to come into the office just to update their prescriptions, especially if it's one they've been taking for an extended period of time. Mental health providers can also use live video and audio to supplement in-person care, especially if one of their patients is having an emergency or the provider is currently out of town. And providers can also use telehealth to quickly consult with patients to see if they are recovering and on track as expected after surgery. In-person visits are certainly more effective if the patient is suffering from a complex condition or debilitating disease, or if the doctor has yet to prescribe their symptoms. It may be better for the patient to schedule an in-person appointment. If the patient is older or has limited experience using smartphones, apps, and/or laptop computers, they may prefer to come in for an in-person appointment. And Finally, the doctor may need to examine the patient in person instead of relying on live video and audio. The doctor may also need to perform tests such as a biopsy, x-ray, or screen the patient for various diseases and conditions which couldn't be done over a device. And I wanted to touch upon current legislation that's been introduced to Congress that may affect telehealth as it is currently. The first is the Telehealth Modernization Act, which specifically allows or would allow rural health clinics and federally qualified health centers to serve as the distance site for telehealth. It would also be the home of a beneficiary, or it would allow the home of a beneficiary to serve as the originating site for all services rather than for only certain services as telehealth legislation currently has. And it allows all types of practitioners to furnish telehealth services. The Ensuring Telehealth Expansion Act would make permanent certain telehealth flexibilities that were established in response to COVID-19 because they've been seen as successful. The Protecting Access to Post-COVID-19 Health Act of 2021 would amend the Social Security Act to authorize the Secretary of Health and Human Services to waive or modify application of Medicare requirements with respect to telehealth services during any emergency period, as well as for other purposes. And the Keep Telehealth Options Act of 2021 would direct the Secretary of Health and Human Services, the Medicare Payment Advisory Commission, and the Medicaid and CHIP Payment and Access Commission to conduct studies and report to Congress on actions taken to expand access to telehealth services under the Medicare, Medicaid, and CHIP programs during the COVID-19 emergency.
So yeah, I want to open up thank you, Catherine, too. I want to open up the floor for any questions for us interns. Oh wait, sorry, Kevin, could you go back one more? Kevin, could you go back a slide?
I just did. It was the current legislation.
Okay. Okay. I just want to open up the floor for any questions someone might have for us interns. You could feel free to type in the chat or use your mic.
Yes, I have a question.
Yes.
So is MyChart a health record into itself, or does it interface with the patient's already existing health record?
So
From what I believe, okay.
Oh, you go ahead, Len.
Well, I think you would actually know more, Kevin, but from what I know, I think your existing record is already on MyChart. But Kevin would know more because he's on MyChart more than me.
Yes, so MyChart is done directly through your health system, so it will have your existing medical records and as well as your previous appointments and everything else.
So, but your existing health record interfaces with MyChart.
Yes.
It doesn't create a new chart, a new health record.
No, it does not.
Okay, how secure is this? I mean, everybody says their systems are secure, but do we have any idea if it's really secure or not?
So yes, MyChart does use the systems of encryption. So the same way that pretty much banks and other services keep their services safe, MyChart does similar, if not the same things.
Okay, and my last question, do other providers have access through MyChart to your information? I mean, could you give them
So, my chart typically is done through systems. So down here in Greenville, we have Prisma Health. So all providers within the Prisma Health system have access to your information through my chart. But if you go to an independent provider, then they probably would need to keep their own records.
Okay, thank you.
Yes, no problem.
Hey, Rich, this is Mark Gibbons. So a while back, if you might remember, I think it was Department of Health Services or someone, they were doing a brand new program called a Blue Dot, where they said that they were going to be able to, you can share your records like this throughout medical systems, but I don't think that has ever taken off. I think that's still in the experimental phase over at the government, unless you may have heard something, but I think that is still something that they were trying to do, and that was even 4 or 5 years ago. And I don't think they figured out the language. That's why it sounds like your records can be shared only within the network, but not within an external network.
Got it. Thank you.
Sure.
I've got a question. Do you hear me?
Yes.
Okay, I have doctors who are members of MedStar. I have doctors who are members of Johns Hopkins, and my general practitioner is a member of neither. I have a my chart for MedStar, my chart for Johns Hopkins. Is there any way that they can all talk together? I find my experience with healthcare in general is there's a lot of silos and people don't talk to each other. Is there any way that they can access each other's information?
So I think that goes a little bit into what Mark was referencing. There is legislation that has been proposed that would allow these systems to kind of work together and transfer their information more readily. But currently, there's nothing in place just due to needing to figure out how that would work because, when you have different systems of health, they may not all operate on the same set of rules, or they might have different terminologies. Things just might be done differently. So figuring out how they would communicate is the big barrier.
So Dick, that what your question is getting at is what's sometimes referred to as a health records bank or a health records depository. So that whatever system, whatever health record you're using, it could be put into the depository for safekeeping, and all your providers, you could grant access to any provider basically in the world. You could grant them access to your information and your record. It's
And
called
is
a
there-
health records banking system.
Is there such a thing?
They're being set up and they're being discussed more and more, and with the idea of growing. The proposal, the federal government spent like $40 billion getting people to adopt electronic health records, but they couldn't talk to each other. And each one was part of a system like Kevin was talking about, and you too were talking about, but they couldn't talk outside of their network. So you go on a vacation to Europe or something, you'd be dead in the water. Nobody could get access to your information. Or if you had an emergency when you were traveling, nobody could get access to your record to help with your treatment. But the Health Records Bank proposal would allow that. You would have secure access, and you would have a number and an access card and so forth that you could grant to a provider.
Good, good.
All right, are there any other questions?
I have one other question. Now, what type of legislation, and maybe you covered it and maybe I just missed it. I know that they expanded the telehealth access and accessibility during COVID, the pandemic. And I know that they did an extension, but how are we reaching the outer areas such as rural America or the inner city where there is a broadband desert? Are there plans to fix this so we can have a equal access for everyone?
Well, that's part of the current infrastructure bill, the whatever it is, $2 trillion or something, huge amount of money. That's
Right.
part of that bill.
Okay. I know they were talking about at one point breaking something similar like that out and put more focus on that, but it sounds like you said, Rich, it's just lumped into that one bill that is, that's out there for debate and discussion right now. So,
Right.
All right. Anyone
Okay, and we
else?
have a couple more questions in the chat. Kevin, I think you can actually answer this one too. How can you look up your health information on MyChart? Asked by Jasmine Tran.
Yeah, so on my chart, there are several different tabs. Like I said, it'll likely depend on the system that you're working through, but there are tabs. Actually, I can bring this up right now. There are different tabs to show your appointments. You also get notifications for appointments. There is a tab that shows your prescriptions, your test results. So really, it's just through navigating the different tabs of the app. They're relatively self-explanatory. I find that it isn't hard to find whatever information you may be looking for. So I hope that answers the question. And if not, I'll be glad to clarify down the road.
Okay, so I think we are ready to go to our next slide. I see a big square in the slide, Kevin.
Oh, yeah, sorry, that was the chat. All right, so you go ahead, Laura.
Jasmine said, thanks, Kevin.
No problem.
So we have a super fast pop quiz. We couldn't figure out how to put up a poll, so you guys are welcome to put the letter that you'd like to answer with in the chat. You can do A, B, C, or D. And the biggest takeaway from this webinar is, what is telehealth? So feel free to put in the chat what you think the answer is, even though we can all probably see everyone's answers, but next time we'll figure out the polls. Wow, you guys are so smart. Woo. So yeah, it is B. And so once again, telehealth is a distribution of health-related services and information via electronic information and telecommunication technologies. So I used the same definition for most of these answers, but I just switched it up just because I wanted to trick you guys, but I didn't trick anybody. So it's B. And yeah, that is our biggest takeaway from this webinar. And you can go to the next.
It's on the next slide.
Okay. Oh, okay, it didn't load for me for a bit, but yeah, thank you everyone for attending our second webinar. Everybody who is here will be registered into a raffle for a $20 gift card, and we'll be raffling off 10 gift cards just like last webinar. And we have everyone's emails. If you didn't sign up with your email, make sure to type it in the chat. And please check out all of our updates through our Facebook, Instagram, or Twitter at RetireSafe. Thank you, interns.
Thank you, everybody, for showing up.
Good job.
Appreciate it. Thank you.
Thank you.
Thank
Thanks
you.
a lot, guys.
Thank you, everyone.
Thank you.